invite another great physician who's traveled to the Northern Province and whose vision, kickstarted all this in the Northern Province. She is a family physician and a palliative care physician. She's a family physician and a palliative care physician in Richmond Hill, Ontario. She's a good friend of mine this is none other than Dr. Meera Selvakone. Please welcome Dr. Meera. Meera, you have 10 minutes for your presentation. I'm sorry, you have 15 minutes for your presentation. Meera, you can share your screen from your computer.
Okay, so I'm just going to go ahead and do that now. Can everyone see the screen?
No.
Oh, okay. Can you see it now?
No. Oh, yeah. Yes.
Now you can see it. Perfect. Great. Okay, that's great. I'm just going to actually start the presentation. Okay, that's great. So first of all, I'd like to thank you for having me speak today. I'm really honored to present on the Northern Province Palliative Care Initiative. So I want to just make a small correction. I am a family doctor. I haven't specialized in palliative care, but it's important to note that I represent a large group of doctors who are primary care physicians who are managing palliative care in the absence of palliative care specialists. And this is very much relevant because around the world, there are physicians that don't have training that are having to manage patients, whether they're surgeons or anesthetists or internists or pediatricians or primary care physicians like me. And we need to be educated on how to manage the needs of our palliative patients, especially when the goals of care are starting to change. So it is a real pleasure for me to recount to you a 3-year journey that I've been on, and in terms of starting this initiative and watching it grow. And I have to say, I've learned so much, and I'm hoping that through the webinar today, a lot of you will learn a lot about palliative care as well. So I'm going to start. I've got, unfortunately, Jonathan and I didn't coordinate well, and I've got the same quote, but maybe that underlines the importance of the quote, which is, you matter because you are you, and you matter to the last moment of your life. And that is from Dame Cicely Saunders, the founder of the modern day hospice movement. And the reason I put this quote up, and I think Jonathan as well, is that this is the one belief that binds all of us who manage palliative care together. It doesn't matter who you are, where you come from, what job you did or do, or who your family is, what background you come from. You deserve to be treated with the greatest compassion for as long as you live. And I think we need to remember that as we go through the webinar today. So I'm not going to dwell too long on what palliative care is, because I think Jonathan explained it very well. But maybe I'll just summarize by saying that palliative care is the care of patients who suffer from disease without cure, who will worsen over time and eventually lead to death. And Jonathan mentioned that there are many other symptoms in addition to pain that palliative care patients experience. And palliative care is about providing that support. I know Jonathan mentioned the concept of total pain, and I want to go over with that again, because I think that's the key to understanding palliative care. Palliative care doctors do not just manage the physical symptoms of the palliative patient. They manage total pain. And that means tackling different types of pain, whether it's psychological pain, so the fears, the depression, the anxiety, the worry, the anger that comes along in palliative care patients, the social pain, so patients who are on palliative, especially we've seen this happen in Sri Lanka and other countries where there's isolation, there's having to depend on others, that brings a special type of pain. The stigma, the loss of roles, the mother who is palliative, or the breadwinner of the family who is palliative, who could no longer bring in finances to the family. And then you've got the spiritual pain. So what is the patient's belief systems, and how do they see their spiritual obligations as they face death? And I think most of us can agree that sometimes it is the non-physical pain that can be one of the more challenging things to manage. So which brings me to Northern Province. Why have palliative care in Northern Province? Well, the population is about 1.2 million. So we are probably going to see thousands of patients enter into palliative care each year. Over 2/3 of the cancer patients treated at Trail Cancer Hospital, which is the only cancer hospital in the north, are in a palliative position. And the other thing that it is special about Northern Province and Sri Lanka is decades of war. And decades of war have left the population struggling. We've seen families and social structures destroyed. And we're seeing the next generation, the children, may not see a hopeful future at home. So many of them are migrating or working abroad. And this has left many patients alone and some even destitute. So given this context, we in the West can only imagine the additional layers of complexity involved when a palliative care physician is trying to manage the total pain of a palliative patient in Northern Province. So how did this initiative even get started in the first place? Well, in January 2017, over 100 delegates from as far away as UK, US, and Norway met with a team 30 strong from Northeast Sri Lanka during an international conference in Toronto, Canada. So I know you're going to ask me this. What brought these people together in frigid, icy cold Toronto in the middle of January, which is quite possibly the worst time to visit Canada? Well, they were here to discuss the health, educational, and economic post-war challenges faced by residents in the northern and eastern provinces of Sri Lanka. One of the visiting doctors from Jaffna said something that has stuck in my mind for the last 3 years. He said, perhaps you can help us to see some solutions to our problems that we who are so consumed on the ground may not be able to see. As conference organizers, we felt it was important that our counterparts back home know that they're not alone, and that sometimes linking hands with the global community of international experts could help move things forward in a whole new way that never happened before. So you're going to notice one picture at the bottom. That is Dr. Lawrence Lowe. He's the medical officer of health, public health for Peel region in Ontario. And he's a warm and generous leader in global health. So he was the keynote speaker at the conference, and he learned about the challenges in palliative care at the conference, and he kindly introduced us to an organization, Two Worlds Cancer Collaboration. So Two Worlds Cancer Collaboration, and Jonathan is representing that organization, and Dr. Gayatri Prahlad as well, is a non-profit Canadian organization whose mission is to assist other countries to reduce the burden of cancer and non-cancer palliative care. And this is an organization that's done amazing work around the world, including in India and Nepal and Brazil and many other countries. And they kindly agreed to make a visit to Northern Province in November 2017 to see what they could do to support the growth of palliative care there. So I was honored to be part of that 8-person team that they sent in Northern Province in November 2017. And I can tell you it was one of the most amazing experiences of my life. We were very fortunate to have palliative care leaders, global leaders like Dr. Gayatri Prahlad from India, Dr. Stuart Brown from New Zealand, Dr. Jonathan Pierce from Canada, Dr. Meera Rajasegaram from UK. We managed to cover, in the short time we were there, 3 districts, Jaffna, Kilinochchi, and Vavuniya, and we met with everyone. We met with the doctors, the nurses, hospital administrators, government officials, university officials, patients, families, and we learned so much about the needs there. Members of our team gave talks for various groups and organizations there, kindly organized by Dr. Serene. And I remember one talk that Dr. Gayatri gave at the Jaffna Managers Forum. So I'm glad to see there are members from that forum here today. At the end of her talk, one gentleman stood up and he said something that I will never forget. He said, any one of us could end up in this situation. Palliative care is for all of us, and we must support this. I think his statement summarized well the purpose of the visit, to gauge interest and resolve and work towards building a palliative care model that would work for this post-war, war-ravaged region. So thus was born the Northern Province Palliative Care Initiative. So as with any project that you do back home, it's really important to have a partner on the ground that's going to be able to do the on-the-ground work. And I'm proud to say that partner on the ground is Kane, or Cancer Aid North and East. Kane is a UK-based charitable organization with a branch in Jaffna that began in 1993 and has worked tirelessly over the decades to support cancer patients in Northeast. They were the first to establish a hospice there in 2006. And I'm actually very pleased because I was scanning the attendees and I see Dr. Kamala Arnasalam, founder of the Kane organization, is here with us today. So and she really deserves our appreciation for all the hard work that she's done lifelong to promote palliative care in the region. So last but not least is iMetro Canada, the third partner in this initiative behind Two Wells and Kane. Established in 2008, iMetro Canada has done amazing humanitarian work around the globe, and it's currently led by its president, Dr. Varagonan, moderated today. And they've taken a lead role in managing the funds for this important and pioneering initiative. But that's not just it. In addition to fundraising, iMetro Canada continues to have an on-the-ground presence, providing in-person guidance and mentorship to the palliative care teams. And I know Dr. Varagonan makes it a point to visit Northern Province at least once or twice a year. And we all very much appreciate his engagement and updates. So there are 4 basic principles behind the Northern Province Palliative Care Initiative that are worth pointing out. So the first is training. So we definitely want to have more doctor nurse teams go for training and educate, like I said, other physicians who are going to be managing palliative care patients that may not necessarily have specialized training. The second is advocacy and education. So we definitely want to get the word out there and awareness out there and what palliative care is. The other thing is making sure that medications are available, commonly prescribed medications for palliative care. And finally, it's important for the delivery of home-based palliative care to dying patients. And I think just before the presentation got started, we did talk about the importance that patients place, the value they place on being able to be in a comfort at their home when their final time comes. So we want to make sure that our initiative definitely works towards that. So to date, the biggest fundraiser for our initiative was the 2018 Tamil Canadian Walkathon that was held on September 9th, 2018. And I have to say, hundreds of walkers got together on a very chilly Sunday morning in September. It was actually very cold that day, to walk 5 kilometers and raise money for palliative care. And so if you guys are listening carefully, just a tip to those thinking of a visit to Canada, please visit between May and August. The weather is beautiful and you will not regret it. I'm proud to say that although we only targeted 50,000, we actually went 10,000 above that and then some. So a total of 60,000 was raised. And I think it's worthwhile sharing some images from the walk. This is just a smattering of images. I have to do a shout out to the Tamil Seniors group in Toronto, the Senior Tamil Centre of Ontario. They got together. I challenged them to raise 10,000. They raised 13,000 for our initiative. So a big shout out to our seniors. Now, since awareness was raised to the walkathon, we've had other amazing stories of people coming forward. We had a couple in Toronto celebrating their golden wedding anniversary, and they agreed to donate their gift money to the Northern Province Palliative Care Initiative. And that money was actually put towards purchasing air mattresses for palliative patients, which is an important part of delivery of care. The Tamil Medical Pharmaceutical Association held a raffle at last year's, their annual dinner last year, and donated the proceeds to Palliative Care Northern Province. And we really look forward to future interest and donations because we need to keep this noble initiative going. So definitely looking towards more support from the community to get to keep this important work in active process. I want to just talk quickly. I think Mother Ann talked a little bit about the updates, and I'll just quickly mention as well. With the generous help and support of the Indo-American Cancer Association, Dr. Kaushik and Mother Ann, two of their nursing colleagues, Roshan and Naradhi Sarasan, received specialized 6 weeks palliative training under global leader Dr. Gayatri Palat at the MNGA Institute in Hyderabad. Very much appreciate that because that's really what kickstarted the whole service in Northern Province. And as Mother Ann said, in January 2019, outpatient palliative care clinics were started, the mobile unit started shortly after, and I'm proud to say despite all the challenges, including the COVID pandemic, these clinic and mobile units continue to run to this day, and that's something we can all be proud of. There continues to be active leadership from Two Worlds. This occurs primarily through the bi-monthly Zoom case conferences. And as Dr. Varganan mentioned, a very lively WhatsApp group. I love seeing the messages pop up there. Members can post questions and get answers instantly in real time. And this speaks, to me at least, it speaks to the tremendous power of technology in connecting all of us. And it's making things like distance and time zones insignificant. So that's, I think, a real step forward in how we're managing to do things now. The future. So we are now running the program in 2 districts, and the hope is that this initiative will expand to the other 3 districts and hopefully also to Eastern Province. We anticipate more workers to undergo palliative care training, whether it's in person in Hyderabad or maybe even Canada, and maybe now in a post-COVID world virtually online. And the hope is that Jaffna will become a center for excellence for palliative care with very strong connections to Hyderabad. And I just want to take a quick, just 30 seconds to recognize the valuable contributions of Dr. Sivaraja Nadaraja, former chair of Kane Jaffna, and Dr. Ambalavana Raghupati, consultant physician. It's very sad for us that they have since passed on, but their passion, dedication, and tireless work towards the building of a strong palliative care system in the North is something that will not soon be forgotten. I want to end with this quote, the end of life deserves as much beauty, care, and respect as the beginning. And I hope we can all remember this message as we come away from this webinar. And that concludes my talk. These are just a few pictures again from our November 2017 visit. And I don't want to mention any names of people there, but you're all, we very much appreciate all your dedicated hard work to help us move this initiative forward. Thank you very much.